Hello everyone, my name is Brian Gingrich, and this is if I was the CEO of JFK EMS for a day. What is JFK EMS? JFK EMS is located in Edison, New Jersey, which is part of one of the biggest communities in the state. It is one of the largest EMS hospital organizations in the country and number one in New Jersey. It has been recognized for its high performance and high quality care, particularly in stroke and cardiac calls. It also has won Lifetime Mission Awards through the American Heart Association, especially for pre-hospital patient care experience, heart attacks, and stroke. The multiple awards in Gold and Gold Plus Excellence in treating conditions related to ACS, STEMI, and stroke. It also has been awarded multiple years with American Heart Lifeline Systems and the Care of Target Heart Attack Award, which has been acknowledged to collaborate between hospital and pre-hospital providers. And for the 11th year in a row, JFK EMS has been awarded by the AHA for a consistent highest recognition in the industry. This organization has over 300 team members, which includes leadership and management, field supervisors, nurses, 911 EMTs, transport EMTs, and MAVO drivers. It covers seven counties, 5 of the biggest towns in the state, 14 hospitals within our network, and about 44 hospitals outside the network throughout New Jersey, New York, and Pennsylvania. The critical care units with our nurses and critical care EMTs are ranked in the top 3 in the country when it comes to transporting emergency patients and call volume. What changes should I make JFK better in just a one day? 3 things I could think of that could make a big difference right off the bat with the limited time I have, which is firing and hiring team members, improving compensation and benefits, and burnout and mental health. Firing and hiring team members. One of the issues that comes to the low numbers of staff is how to conquer the staffing issues. As we maintain a minimum trucks on the road for each staff, there will be staff with some bad record for calling out, leaving early, or refusing to make specific calls, such as CPR, hospice, pediatrics. Looking back in 2015, New Jersey had about 26,000 EMTs in the field, as well as 2,000 paramedics that were currently active with their license. But when the COVID pandemic hit in 2020, the numbers dropped significantly after the first year of the pandemic with 22,000 EMTs and only 1,600 medics. As of currently today, there are only 1,800 active EMTs and 1,300 medics, and the number continues to be decreased in the next 5 years. In the last 2 years, JFK EMS has created the EMS Experience Apprentice program, which helps gain interest from new members and individuals who are willing to work with this organization, train, and get the proper education. With so much interest throughout the state working with the best EMS hospital organizations, changes to current staff need to occur. To keep numbers rising and keep a minimum number of EMTs, we're going to look at all EMTs and medics who have a bad track record, who've been written up multiple times, who's not been putting effort in their shifts due to leaving early or refusing calls. We would like to fire them so we can make room for the new EMTs who have just graduated the program, or those who are transferring from another organization that has years of experience. Improving compensation and benefits. In the realm of first responders, EMS workers are paid much less compared to fire and police. The low pay and limited career advancement has impacted recruitment primarily when the staff shortage exists. The average EMT will stay in the field about 4 years before moving to another field to make more money and benefits. Someone like me who's been in the field for 12 years, if I was a full-time EMT, I'd be making about $26 and change compared to fire and PD where you make about $43 at that year. One of the prime good examples that we have throughout the country with EMS is going to New York City Fire Department, where their EMS starts at 35,000 and after 5 years can only get up to 50,000, while fire and PD in 5 years will make over $100,000. Team members see this as third-class citizens, as we risk our lives in different ways with long training and education to help those in need, and yet we must work harder just to make a decent living. Burnout and mental health. To help the members of EMS who are dealing with burnout and mental health challenges, we have to prioritize by creating a supportive and work environment and self-care towards strong connections by using resources like counseling, peer support systems, and stress management training that help maintain work-life style. Unfortunately, there are some issues when we do work a 12-hour shift with nonstop calls. Individuals might not want to use the programs that are offered within an organization and might result towards alcohol and substance abuse, which will lead towards a long-term issue with their work performance, and hopefully it could also hurt as well the patient care. Thank you for your time. My name is Brian Gingrich, EMT CEO for one day.